Okay. I'm at Virginia Mason and Group Health. It's a collaborative venture between those two groups. They're separate patient care facilities, but they share ORs, and it's a general surgery rotation. So we tend to do more complicated cases at the bigger hospital and more day surgery at Group Health.
Mm-hmm. Right now I'm at Harborview Medical Center at the inpatient psych unit.
I'm at the Veterans Affairs Hospital, just down the street, working in the spinal cord injury unit.
Mm.
I'm at the UW Pain Clinic doing behavioral medicine this time.
I'm working with a surgeons group called Pro Alliance, doing orthopedic surgery in Kirkland. Emergency medicine in Harborview. I worked as a medical assistant in the ER.
I was an Air Force medic for 6 years, and my background was also ER.
And I was an emergency medical technician for about 3.5 years.
I was an Army medic for 10 years.
I was a firefighter EMT for 8 years. I think it's all relative. I mean, I think that we felt prepared but not prepared. I mean, I think that our preceptors kind of prepared us that you won't really feel like you will know what you're doing, but once you get in there, it'll all kind of come natural. And
I definitely know that I felt more confident because of the length and also the intensity that we had in terms of our education in the didactic year at Medex. I think that definitely helped me feel a bit more relaxed going into it from my prior background.
For me, I wanted kind of more of a relationship with patients and to be able to follow up with them and do more for them, because I feel it's pretty limited for me it was pretty limited for me as an EMT as far as patient care went. So to be able to kind of follow up and be able to diagnose and treat them was kind of what I'm looking for.
For me, I love the ER. It was really interesting every day, but I miss continuity of care. And as a tech in the ER, you kind of go in, start an IV, and then you're done, you know. And I really wanted to develop a relationship with patients and kind of help steer people to make medical choices in their life.
Probably emergency medicine or surgery for me.
yeah, most likely the same. Or, I mean, I'm interested in underserved as well, but emergency medicine is kind of where I feel most comfortable. So.
I'd be happy in either urgent or emergent care, something like that. So.
I'm interested in probably family practice. Okay.
Probably family practice for me too.
Yeah. And family practice because, just out of interest?
Yeah, I mean, like I said, the ER is kind of cut and dry. Like they have a phrase that you treat and street the patients, and you don't really ever see them again. So family practice appeals to me because you do have that continuity with the patient. Mm-hmm. Correct. Yeah.
Looking after their children's children. Yes.
Exactly.
Yeah. Yes.
At first I was a little worried that I wouldn't know enough for clinical year, but I'm finding that I'm really learning a lot as I got into the clinical year, and I think that's just how it will be with any specialties. Like wherever you go, you're going to continue to learn.
I think one of the unique parts about the PA profession is working with very intelligent physicians who've been in school for a long time, and when you come alongside them in your new job, or even in this clinical experience, what we get to do is we get to learn how they like things done and how they want efficiency in their job, done. And I think being part of the PA profession allows us to be trained by them in the way that they specifically like, and I think that's what makes it such a workable model in that sense. And I think that's where the OJT really does come in after the general education, the didactic year, I think.
I think that's circumstantial to the clinic or the site or even the specialty. I think some sites are more liberal. Some people's experience might be less hands-on, more intake, and some people might have a complete different experience where they have more direct involvement in the patient's care, or maybe moreover it feels like that they are their patients. So.
I feel like, didactic year, we learn all this stuff feels like really quick because the year goes by fast, but it does come back to you the clinical year, and you get to review. You have time to study and review as you're doing it. So in that respect, I feel like there's time for that. As far as what we could have prepared more for, maybe more workshops as far as, you know, suturing skills and IV skills, but other than that, like, we learn it in clinical year as well. So.
For me right now, I'm going through, so I don't know if you guys, how much they explain this, but for our clinical year, there's a 4-month preceptorship, and then there are 1-month specialty rotations, right? So I'm in the middle of my 1-month specialty rotations, and that's for me, that's very rewarding. I have an opportunity to go, each month I go somewhere new, and I get kind of this totally different experience, and I get to see something completely different, and fall in love with a whole new specialty, and then move on next month. To speak to your question about the generalist approach, and this is just obviously anecdotal, but last month I was in Wenatchee working substance abuse, and it was a very rewarding experience. But I was able to bring a lot of kind of the Medex's primary care focus to that clinic, and I really felt like I was giving them a lot, even as a student, giving them a lot of added value in kind of primary care. Let's talk about hypoglycemia and diabetes medications and what we can do and what we can't do.
I don't think I would have wanted to. I think I really enjoy having some sort of background in tier system to build onto. You know, I'm sure you could do it. I think anybody could do it if they really had that goal set, but it's definitely a lot easier, and I think it makes it easier to communicate.
I think the program is specifically designed for people with experience. They do some day one review stuff, but for the most part, it's designed to take someone who's been in an emergency room or been in a primary care clinic and worked with patients, and then move them from to a more of a provider's role.
I think there's a huge part to having had a life and having had a profession before you move into this that gives you a certain amount of maturity, I think, in healthcare, that maybe if you would have started out kind of, you know, wet behind the ears, you might not necessarily have appreciated. And I think that definitely helps in the clinical year and the didactic year to appreciate where we're going.
I think with patients as well. You know, I think life experience goes a really long way, and patients can tell, you know, if you're more confident than if you were a 22-year-old first-year med student, you know, with no medical experience before. So I think that's really served me well, having 6 years prior, you know, patient care experience before this.
I think when you're older, and you want something, and you have a passion for it, you're definitely going to apply probably more of a professional outlook on things. You're going to take it more seriously. I think when you're younger, you tend to just go to school because you have to go to school. But I think what's neat about our profession, at least as adult learners, is you're coming at it from the angle of, I really want to do this, and so it becomes more of a passion to study harder, to do better, than it is just, I need to make grades because I'm in school or I'm in university. That's it.
One more thing I would just add to that is that when you bring in such a diverse group of people, you can kind of draw from the other students. Medex really pushes. They don't mandate. They really push these study groups and varying up your study groups and reaching out and finding the respiratory therapist and talking to him about the pulmonary functions test when you have no experience with it, so that you get that clinical experience brought to the classroom for you. Not that instructors can't do that as well, but you know, we spend so much time outside of the classroom studying in that didactic year that, you know, it's really a benefit, I think.
It's a real agree, isn't it?
Once again, it's all perspective. You know, it's all this rotation is maybe less hands-on because it's behavioral medicine and chronic complex pain. So my patients have been seeing the same provider with the same medications, and I can attempt to implement new medications, but they've tried, you know, the majority of the medications I might be suggesting, and it's limited. Surgery, way more hands-on, starting from observing the first week to first assisting from then on out. I mean, I think everyone could say it's all retrospective. So.
Yeah, so I'm in orthopedics, so neuro exams for spine, you know, doing shoulder exams, doing, you know, knee exams, and then in the OR, everything from, you know, prepping the patient, positioning them, and then, you know, making sure that the correct sets are open for whatever procedure we're going to do, and then basically assisting the surgeon throughout the entire surgery, and then closing the patient, and then following them in recovery. So I think it just kind of depends on what rotation, but what that's kind of neat about the PA profession, it's kind of like a chameleon. You can just go where you're needed most and learn, you know, each place something different.
Right now, like I said, I'm doing Harborview inpatient psychiatry, and we pretty much round as a team with an attending physician and my supervising PA and a couple other medical students, and we interview patients as a team, and I interview my own patients assigned to the team, and you know, so does the other med students, and we follow up with those patients daily as they are in the hospital, and then prior to that, I was at my underserved rotation at a teen clinic, and there was similar to family practice where I did patient exams and helped prescribe medications and stuff like that. So.
I'm at the spinal cord injury clinic. It's an inpatient rotation. My preceptor PA and her attending are responsible for the inpatient management of these patients as they are when they come to the hospital for whatever reason, and they end up coming as spinal cord patients. They come quite frequently, and so I've been able to do a lot of admission and history physicals, you know, setting up the medications, coordinating the consults with the hospital, with the other services in the hospital. It's been, I feel like going, you know, 0 to 100 miles an hour on this. As a military medic prior to, I have very little experience with this, so, but it's been very good. They've given me kind of shove you in the room and watch you go kind of attitude. It's been a very great learning experience.
So for instance, this morning, I have a couple of patients that are being hospitalized after their surgery, so I go and pre-round on them in the morning. Just do kind of a general physical, make sure that nothing's changed overnight, and then I'll give a report to the physician who's also taking care of them. And then if I have a case in the OR at Group Health, then I'll drive over, you know, assist in the OR for that. So this rotation is really fun because it's just different every day. I'm in different buildings every day. I get to see all kinds of vascular cases, abdominal cases, different sorts of, like yesterday we did a salpingo-oophorectomy and took out, you know, an ovary, and that was the first gyne case I got to see. So I've had such a huge variety. It's been really awesome. It's been a great rotation.
Time management.
Cool skill.
Yeah. It's the schedule during the didactic year is pretty basic. It's like 8 to 4, 9 to 5 type schedule, and if we manage our time well, it was okay. It was fine. We were able to study when we got home, and a lot of us, they don't recommend us having jobs after or during the school year because it's very time consuming. So yeah, it's a good balance.
I couldn't imagine having a job.
No,
it would seem impossible.
Yeah.
I think it starts here in the United States as a good example. The PA model, I think, has been something that's been utilized by physicians, you know, as part of the medicine model, where we work hand in hand very closely, and I think it's played itself out. Now you can see that. I think, what are we, over 60,000 strong now? I think
80,000.
80,000, excuse me.
It's a success, isn't it?
Yeah, the success is probably obviously in the numbers, and I think it keeps going up exponentially. And I think probably what makes it work is that physicians are increasingly having larger and larger patient loads, and they need competent professionals that can come and help them, but that aren't necessarily or didn't have the opportunity in life maybe to go to medical school, or had a different life experience, but still want to be part of the medical, you know, the medical establishment, and want to do their best to help society and make a difference. And I think the PA profession gives an opportunity for those individuals that didn't necessarily maybe have the time to go through 12 years of medical school, or maybe the money, or maybe just didn't get in, or maybe just wanted to do something different with their lives and have come to it from a different approach. I think that makes it a very viable option in terms of cost savings and also in extending the services of physicians.
I think that's the key to the success here is that our profession has working with physicians extended that high level of care to the patients in a support role, not trying to take over anything, but working with the physician to help the patient.
Well, from what I understand, a big difference in nurse practitioner versus PA is nurse practitioners practice under a nursing model, just more advanced. Whereas physician assistants would fall under, a medical model like a doctor. So they are coming at it with a slightly different approach to patient care. So I think you're still going to have a difference somewhat in that because nurses think differently than doctors in practice. So I don't know if that answers your question.
It's a different way of thinking.
Right.
Yes.
Right.
Just an extra tool. I mean, it doesn't have to be something that takes away from their profession, but cohesively working in a different approach.
I definitely think team medicine's the future. I mean, the more the healthcare costs come up, we're going to have to address that by having competent professionals that can fill the gaps and extend services to people who don't have that as part of the Medex mission. And I think that PAs, they fit that role. They don't assume to usurp the authority of a physician. They work with the authority of their attending physician. I think that it gives that team medicine credence. I think it doesn't have to be an us versus them thing. It can just be an us helping everybody thing. And I think that's kind of an important distinction. I think that PAs have held to since their inception, I would imagine.
Probably my first week of my psych rotation, which is the one that Christine is at now. I had that last month, and I don't have any psych experience whatsoever as before PA school. And this is inpatient psych at Harborview, which is, I would venture to say, probably the most acutely severe psych patients probably in the city. So it was very eye-opening, and the way they do it at Harborview is they do like a team approach where you're interviewing patients as a team, so you're sitting down with 4 or 5 colleagues, and they kind of expect you from day one to just start interviewing these patients, and I was just like, I don't know what to ask you. But it's good because it's kind of trial by fire. You just jump right in. It takes you out of your comfort zone, but I think that stretching you is a good thing, because you learn more that way, I feel.
I think Medex does a pretty good job preparing us to feel like we're in the depth. I think all of us feel. I mean, at least I can't speak for everybody. I think for me, every new rotation, I feel like I'm about to jump into the deep end. So the big thing that they instill with us is just relying on that basic clinical skills. I mean, quarter one, where can you get a good report? Can you relay a good message? Can you paint a picture that maybe if you feel out of the depth is too deep, that you can instill some sort of picture to your provider so that he can say, or she can say, okay, I kind of get a better idea for what you're saying. What do you think? And then it gives you a little bit more confidence that you were in the right direction. I mean, I think in clinical year that's been really beneficial towards kind of making me feel confident. They give us this rainbow book. Have they talked to you about this rainbow book? I don't think they actually do the rainbow book anymore. They got rid of it? Yeah, it's computerized now. I highly recommend doing this. I mean, I still carry it in my bag with me. I use it to kind of refer back, but every week we did 1 or 2 of these basic clinical skills that were body focused or system focused, I guess, moreover, and they cover all aspects and certain things that you might kind of just put in the back burner. You actually are able to recall because it was so embedded in the first quarter. I mean, it was literally what your whole quarter was focused on was how to assess a patient on a physical level and then a history level.
So we would learn a different exam every week through the whole fall quarter. And I don't know about you guys, but for me last year I was so worried that, well, we're learning this fall and we're not even going to use this until next year. Like, I'm going to forget all of this. But it really does come back.
Yeah.
And they told us that. They're like, no, it'll come back for you. And I was like, I don't know. But it really does.
Yeah.
I know as of right now, there's not a lot of ophthalmology jobs for
Right.
PAs, but that's really the only
Was
specialty. No, they have OB-GYN too. But I think that's really the only specialty I can think of that they haven't really infiltrated fully yet.
I think it sounds more like the second, the latter. I mean, I don't know what everybody else has done, but I picked something that I'm interested in, gastroenterology, and I'm not really sure if I'm going to use that to find a career later on, but that would be the intent, right? To say, well, I've done this rotation. Sir, ma'am, I think that I'd be a good fit as a new student or as a new PA. So.
I think it's a nice slot option for folks because you can't cover everything in education for medicine, but you might have somebody that's interested in something, and it gives them an opportunity to see, is it a fit for me or not, that particular side or aspect, I think, of medicine.
I think they purposely want us to see how different medical systems work. Because in the U.S., it's, whatever insurance you have depends on what facility you get to go to, and so you kind of see a little bit of how different systems work, which is good, because you see positives and negatives for everything.
We have in didactic year, we have a maternal child health course, and I thought that was pretty helpful as far as being able to treat peds. And I actually did my underserved rotation at a high school, which was a teen clinic, and I think as far as experience in family practice, you see a lot of pediatric patients there, and you can also ask for it as an elective to do peds.
Yeah, I wouldn't say really any support in regards to there's occasional emails I guess we'll get that says that this site potentially is looking for PAs, but in general this seems more like a training focused program in regards to job placement program.
I imagine, we're only 3 months into the clinical year, but I imagine that we're going to have in our on-campus meetings that we're going to have an opportunity to learn a little bit more about what comes after graduation, specifically our boards, and then applying for a position. I think from a lot of my friends who've been through the program, probably you guys have heard this too, resumes start going out. I think anywhere from 5 months to right toward the end, toward graduation, toward the places where we've rotated at or through positions that are with PAs. But I think what's neat about the system we have here is it's like having almost a new job interview every month during the 6 clerkships that we have. And then the family preceptorship, it's almost a chance that not only do we get evaluated as students, but also we're evaluating these locations as possible places where we could conceivably see ourselves working, I suppose.
I sure hope so.
That's a yes then. We're looking for PAs.
It already seems like it has in regards to Medex focus towards New Zealand right now, and we just received a mass email in regards to an international missioning group for PAs. So it seems like that's already in fruition right now, or beyond fruition. Yeah.
Absolutely. Canada as well is looking to move. CAPA is looking to move new legislation so that maybe British Columbia will be maybe the next province to open up to PAs as well.
I don't know if this makes me extra special, but I would just like to, the one thing I'd like to impart to you guys is the focus on selecting students that have real life experience. The idea, the model that moves more towards just an academic focus prior to PA school, I think you miss some of the spirit of the concept of bringing people who've had a life into the healthcare profession, into the provider role to assist the physicians and provide that level of care. I think that's the key ingredient that really sets us apart.
Would you say that original focus on military as well is like beneficial?
I mean, the military provides a lot of experience, but I don't think that's and I think that's a very good core portion of it. But there are other careers that provide plenty of opportunity as well. So.
I agree. You know, one of the things I think what drew me to it, I was a commercial banker before going into working in ER, which is completely different. I think most people would say, well, how did you even get to do that? I think it's neat that the PA profession allows people to mobilize from all kinds of areas in society to come, and if they want to do medicine, they still can. I think the training is rigorous and it's not for everybody, but it's of the right length to prepare you, but at the same time it also is of the right length to give opportunities to folks who want a different career or change careers. It's not uncommon for somebody to go through their life and think that they want to do something different. And I think it gives the ability to be altruistic with that choice, becoming a PA, I think.